Hi, my name is Dr. Youngsuk Victoria Suh. I'm a plastic surgeon and welcome to Victoria Plastic Surgery Center. We're going to talk about eyes today, rejuvenating your eyes or lifting your eyes, or what's known as blepharoplasty. We all know how important eyes are. Some people say it's the window to our souls. That tells you how important we consider our eyes to be. So when we're talking about blepharoplasty, once again, I'm a girl that likes the basics. It's like you have to have the right foundation when you're building your house, so why not do the same thing when you're a surgeon? After all, we're looking at enhancing your body, but we have to look at your anatomy. So first of all, before considering an eyelid, did you have an exam with your ophthalmologist? Did you look to see if you have a dry eyes that went undetected? Or maybe you have a baseline glaucoma that you didn't know anything about? Do I sound like a medical doctor? Yes, I am, but that's very important for blepharoplasty. So before considering it, go get your eye exam to determine the status of your eyes. And once you've done that, go seek a consultation with plastic surgeon who's board certified. So let's consider blepharoplasty. What we look at is the position of your eyebrow to determine whether your forehead has dropped down, and maybe that's the reason that you feel tired and you feel like there's a lot of weight on top of your eyes. Or is it really just the loose skin? Do you have fat that's actually protruding out, what we call periocular fat herniation or bulging fat? Is that what's bothering you? And then we have to look at the relationship of the corners of your eyes in relation to your face. How about your lower eyelid? Do you have loose skin there? Does it look wrinkly? Or do you have fat? Those are very important considerations. So when we do a blepharoplasty, we're not just looking to tighten your skins, but we have to determine how we can proportion your soul, or the window to your soul, which are the eyes, to be in the right frame. So you can consider an open technique if it's loose skin with wrinkles and you want to take some fat out, or you can do closed technique if it's just removing the fat or minimal incision. And a lot of women wonder, well, why can't I do lasers? Yes, there are options that are non-surgical. If you have wrinkles around your eye that you would like to improve, you have some loose skin but they're not that bad, and you have some fat but they're only present on certain lights, then you can consider non-surgical lift, such as thermage around the eye, CO2 lasers, or erbium resurfacing. You can consider other options such as Botox to get rid of those loose skin and maybe a little bit of that crepey look and the wrinkles around your eye. However, if you really do have loose skin and you have fat, you need to consider an open technique where surgery is involved. And surgery means that you make an incision along the crease of your upper eyelid to reduce the loose skin and excise it, to remove some of the fat, and then to rejuvenate your eyes. If it's a lower eyelid, you can make an incision just below your ciliary line, extending to the lateral corners. When you say ciliary margin, that's just below your eyelashes. Go in, take the redundant fat out, or that bulky fat that you're talking about, and the loose skin, and then close it back up. Surprisingly, surgery is well tolerated with minimal pain and short downtime. And you can cover a lot of the bruising and the swelling that comes from the surgery with camouflage makeup. In addition, a lot of people wonder, can we actually do a knifeless surgery around your eye using the lasers? Yes, what that means, instead of using what we call a cold knife, which is a scalpel, to make the incision, some surgeons opt to use the laser to make the incision. However, I believe that brings more swelling and we'll recover more swelling. And when we are recovering, what we want is the shortest downtime, which means minimal edema or swelling and minimal bruising. So therefore, I truly believe that using the traditional surgical technique is the best when you're doing the open blepharoplasty. It doesn't matter what ethnicity you are. It doesn't matter how tall or how short. But when you have that shine in your eyes, it looks like $1 million. So when you're considering blepharoplasty, don't forget the basics. Get your eye exam, get your consultation, and let's make your eyes shine. Come see us at Victoria Plastic Surgery Center.